Good afternoon. My name is Gerard Meuchner. As Ryan said, I'm the Chief Communications Officer of a company called Schein. I have to say it's quite a humbling experience for me to be here. You could have doubled my high school SAT scores and I still would not have gotten into Harvard. So the idea that I'm speaking behind a podium that says Harvard Law School is really quite something. I am here representing the private sector and speaking specifically about supply chain. Let me tell you briefly about Schein. We are not a consumer products company, so I'm assuming most of you have not heard of us. We're based just outside New York City. We're a Fortune 500 company, have about 22,000 team members, about $12.5 billion in revenue, and we are a very large provider and distributor of infection control products, gowns, gloves, masks, all of the things that doctors need and physicians need to respond to an emergency. And we've had a long history of emergency preparedness, but the discussion for us really changed around the Ebola crisis. One day at my desk, I got a phone call from the CDC. They called me directly, and it was actually the CDC Foundation, and they said, "Can you donate supplies to us because we have all these physicians who are going to West Africa, but we don't have the equipment to give them." And it's a whole separate political issue I won't go into about why the CDC itself couldn't equip these folks. But the CDC called us, and so, of course, we donated everything they wanted. They sent us a long list of products, and we made the donation. But that again was in 2014, but that began a discussion that culminated at the annual meeting of the World Economic Forum in Davos the following January. And there was a meeting among the CEO of my company, a fellow named Stan Bergman, who happens to be from Africa, which is relevant to the discussion. And what I would call the 4 Ws, the World Economic Forum, the World Health Organization, Mike Ryan's group, the World Food Program, which you may not be aware is the logistics arm of the United Nations, and then the World Bank, and Tobias mentioned the work that the World Bank is doing. And so there was a meeting late on a Friday at the end of the annual meeting, and the Director General of the WHO at the time, Margaret Chan, said, "What can we do working with the private sector?" And so my CEO said, "Anything you want us to do, call us, we will be there." And that led to what is now an organization called the Pandemic Supply Chain Network. And the Pandemic Supply Chain Network is a coalition of organizations, companies you would have heard of. Johnson & Johnson is one. UPS is a company. Becton Dickinson is another large participant. Schein serves as the private sector lead of the Pandemic Supply Chain Network. And our purpose is to improve supply chain response to an outbreak. At a meeting in Geneva at the Forum's offices a few years ago, I had the privilege of sitting with the president of the World Bank, who himself is a physician, Dr. Jim Kim. And we had a long discussion about the challenges of getting basic supplies into the field. And he said, so now I realize pandemic response is fundamentally a supply chain exercise. And it is a supply chain exercise. Ron Klain spoke earlier of the wonderful work that NGOs do in sending physicians into the field. And these are heroic people. But we shouldn't make them suicidal. They shouldn't go into places without the proper equipment they need to protect themselves, and the gloves and the gowns and the mask, right? Because if they don't have that basic equipment, they're much less likely to volunteer to go into the field, and we shouldn't put them in that place. So the Ebola crisis taught us one enormous lesson, which is that we have failed to learn the lesson from all of the other outbreaks that have preceded it. A perfect example. During the Ebola crisis, the Wall Street Journal wrote what is, in our community, a rather famous front-page story about how hospitals all around the United States were attempting to gobble up all of the personal protective equipment, as we call it, the gloves, gowns, and masks, because of the Ebola outbreak. Now, the chances that a community hospital in Des Moines was likely to have an Ebola patient was extremely rare. But America being America, every hospital gobbled up what they could, right? When in fact, the best way to protect the spread of the disease was to send that equipment where it was needed, which is West Africa. So it dawned on us that we have this enormous supply chain imbalance where in these moments we're not getting the supplies to the places it needs to be, and rather those countries that are wealthy and have the ability to absorb the supplies tend to act in their self-interest. So Ron Klain also threw out the challenge, which we're happy to address, that the private sector needs to do more, and we absolutely need to do more. Every sector of society needs to do more, and specific to supply chain, I can tell you that Henry Schein and the companies that are involved in this network absolutely want to do more, which leads to another interesting development. And I'll speak frankly here, and Mike Ryan have had this discussion. Historically, there has been a level of perhaps misunderstanding and distrust between the World Health Organization and the private sector, and it's pointless to belabor why that is. But the good news is we have been using this period of time since the Ebola crisis to get to know each other really, really well. And this is enormously useful because you don't want to start exchanging business cards in a crisis. You need to know who all the players are. And in a meeting in Geneva at the World Health Organization a few years back, I sat right beside Margaret Chan, who said to me, "We want to work with the private sector. We need to work with the private sector. You guys have the products. You ship the products. Without you, we can't address the outbreak." By the same token, we in the private sector absolutely understand the vital role that government plays, that international organizations play, that NGOs play. We have product, we have shipping, we have transportation. What we don't have is expertise on the ground to deal with an outbreak. So complex problems will not be resolved individually. They will only be resolved working in partnership. And so the private sector supply chain work now has a wonderful relationship with the WHO, and the real beauty of it is the relationships we're forming are outlasting changes in personnel. This can't be the kind of thing where you get to know someone, you have a nice meal together, and then they both leave the organization, and that's the end of the work. So there's a new DG, Dr. Tedros, who again remains committed to working with the private sector to advance this work. So just a few more points. There's the timing of this event is auspicious. Just this week, and I'm going to sing the praises of Mike Ryan and the WHO. They released a document known as the disease commodity packages, and it's something that we in the private sector are just so excited to receive. So Mike and his team have done the really hard work of identifying across a range of pathogens what are the specific products that would be needed in an outbreak, and giving us a sense of the kinds of quantities that would be involved. And now they made that public. I think it was Wednesday or Thursday, Mike. And so now that we have it, we in the private sector can take those disease commodity packages, or DCPs as we call them, and begin mapping against it. We can say, okay, this supplier has volumes of this particular product, and that supplier has volumes of this product. We can also work with UPS, because again, UPS is a huge freight company. We can say, okay, here are the kinds of volumes that would be shipped in this kind of event, and you, UPS, need to begin thinking about how you would make space available in your system to make sure that this product gets from wherever it's manufactured to other parts of the world. So we're really, really excited about the arrival of these disease commodity packages. That said, this is far more complicated than I think people appreciate. So one of the other W organizations we are involving in our work is the World Customs Organization, because one might think it might make sense in terms of, or rather in times of an outbreak, that product would be shipped and it would be expedited into the field. One might think that, but that's not quite the case, right? Because every country has its own customs regimen. Oftentimes, they are not consistent from country to country. Too often, basic materials will sit in a warehouse or sit on a dock, and their movement into the field is delayed because of some customs issues. So we're having what we think are fruitful conversations with the World Customs Organization to say, can we create kind of a roster of basic product that would have pre-approval, so that in the event of an outbreak, all of the wonderful, heroic physicians who are going into the field don't have to wait for the supplies to get there because it's hung up in some loading dock in some port because of some bureaucratic issue. So there are lots of things that have to be done to make this pandemic supply chain network operational. The good news is we have commitment from all of the relevant parties and a sincere interest in doing that. Just a closing comment. There's oftentimes this view that, well, why is the private sector involved? Well, I can tell you, speaking for my company, but even the companies that are part of the network, we're involved for two reasons. One, it's absolutely morally the right thing to do, right? We all share this earth with everyone, right? And so we have the same values and the same interest as you do. But from a business perspective, it's also enlightened self-interest, right? Business cannot succeed in failed societies, and we have every interest in making sure that every society is prosperous. It's good for the people, it's good for their economy, it's good for the world. And so the motto of the World Economic Forum is committed to improving the state of the world, and that is the animating driving force not only of the forum but of the pandemic supply chain network and those of us who are involved. So with that, I'll close and look forward to your questions, and thank you for your time and attention. Take care.